Governor, I'm interested in the politics of this. I'm a little surprised to hear you talk so much about the public option when I hear that there is zero chance that it's going to get through the Senate. What can you say about that?
I controversially predict that the president will sign a bill in December and there will be a public option in the bill. And here's the politics of it. You know, first of all, the last place people know what's going to happen is in Washington, and the last place, second to last place, is in the press corps in Washington and on cable television. Here's why I think it's going to pass. The Republicans have taken themselves out of this for political reasons. And so the majority, the vast majority of Democrats, both in the House and the Senate, want a public option. So if only the Democrats are essentially writing the bill, as soon as you get past the committee process, you're now just dealing with the universe that includes a vast majority of people who want a public option. So I think that is a consideration. The other consideration is sooner or later it's going to dawn on the people in the White House, and I'm not talking about the president, but his staff, that they're desperately going to need a program to actually show people that this is not all the terrible things that have been said about it. This came to me about 3 weeks ago. I was the first governor in the country who did signed a civil unions bill, which basically gave gay Americans the same rights as everybody else. And it was a brutal, even in a progressive state like Vermont, it was wicked. I mean, people were saying, you know, this is going to allow your children to be taught how to be gay in the public school system, and on and on and on it went. And once it happened, no big deal. People did, oh, hey, gee, I guess my son didn't get taught to be gay today, so I guess this really wasn't as bad as everybody. Because the thing went into effect and people realized it didn't affect their lives, except unless you're gay or lesbian, which is substantially less than 10% of the population. Healthcare is the same way. People are really cranked up about this, and they believe, a lot of people believe the death panels and all that kind of stuff is really going to happen, and socialism, and it's going to, you know, all that stuff. The bureaucrat between you and the doctor. So I think my view is you got to get this thing up and running for political reasons by November of 2010, and you got to have a lead time that people notice. And lo and behold, they're all of a sudden going to realize, hey, wait a minute, this is just what my mother has. This is no big deal, and nothing has all really changed that much. I'm 50 years old, I'm out of work, I can't find another job, and now I can sign up for this public option. Even if only 5 million people show up, it'll kill all the rumors and the fear-mongering and all that stuff. So I think it's going to pass. It may not pass I hope it frankly doesn't pass the way it was written. It exists now because it's a more complicated bureaucracy than is necessary. All you need to do is let people under the age of 65 sign up for Medicare with some circumstances and some limitations. And if you do that, then you got a public option. I think it's so obvious and so logical, I can't imagine they're not going to end up passing it at the end of the day.